in Sonoya, the miners west of Green Valley. It needs to help that lady running a beauty salon out of the back of her house, and the hourly workers in the rural school district who don't qualify for current public programs but can't afford the insurance offered by their employer. People that live in rural District 8 tend to be older, poorer, and sicker than their urban counterparts. They tend to be uninsured and have access to fewer hospitals, primary care doctors, specialists, dentists, and mental health professionals. Thank God for the community health centers and the public health departments and the other private practitioners and groups that have made commitments to these areas. Part of health reform has got to be taking the doctors to the people instead of the other way around. Which is all to say that reform will come none too soon to rural District 8, where I spent 22 years. I can tell you that people need both places to go and health plans that will accept them and that are accepted at the places that they can go. We need it all. I have worked with some of the best doctors there are, and I'm using the word doctor as a term to stand for all the nurse practitioners, physician assistants, pharmacists, and all the others that work to heal people and keep them well in rural areas. I've worked with primary care doctors that love the people more than the diseases, that know how community-based care builds families and communities and are willing to make these difficult commitments. Health reform in District 8 must include the training and supply of more primary care doctors. We also need to make life a bit easier for them. One of my colleagues in a community health center in southern Arizona told me they work with over 1,000 insurance products. 1,000. I can also tell you that our doctors found it no less easy or beneficial for their patients to argue with private insurance plan staff or even HMO medical directors than to contest access Medicare or VA policies. Not one bit. Representative Giffords, we have the opportunity and the obligation to reform these travesties now. In terms of truly managing cost over the long run and having the money to reprogram back into chronic care management, prevention, and improved access, clearly a single-payer strategy would be most effective. Next step is a public plan option widely and immediately available alongside newly and heavily regulated private plan options. Public plans and programs like Medicare, the Veterans Administration, and the Community Health Center program have admirable and worthy track records upon which to build. I have heard no problems in terms of cost, quality, level playing fields, or sharing of risk for which there are not at least the building blocks of solutions already available. The opponents of health reform, those using the Frank Luntz terms and concepts meant to confuse and scare people, or those using the swift vote tactics, are playing cruel games in the face of the realities of healthcare in people's lives. We're talking about the difficulties of being and staying a primary care doctor in southern Arizona. We're talking about getting hurt and being broke. It's about having to stay in a job that you hate, if you have a job, just for the benefits. It's about not being able to take care of your own children. It's about you or your spouse getting cancer and not being supported by the insurance you thought you had. It's about needless suffering on top of unavoidable suffering. And there's got to be a better way, and there is a better way, and Representative Giffords, please help lead us there.